The official definition used by the World Health Organization, WHO, and many international organizations for adolescents is 10 to 19 years old. It is very common for menstruation to be more painful during early adolescence. This medical condition is known as primary dysmenorrhea, and there are several biological reasons why it feels more intense during this ages. 1. High levels of prostaglandins. The main culprit behind period pain is a chemical called prostaglandin. These chemicals are released by the lining of the uterus to make the muscles contract, squeeze, so the lining can be shed. Many teens produce higher levels of prostaglandins, which causes the uterus to contract more forcefully. These strong contractions can momentarily cut off oxygen to the uterine muscle, resulting in sharp, intense pain. 2. Hormonal maturity. The brain-body link. When a girl first starts her period, the communication system between the brain, the hypothalamus, and the ovaries is still maturing. In the first year or two, teens often have anovulatory cycles, where an egg isn't released. When they do start ovulating regularly, the sudden shift in progesterone can lead to a thicker uterine lining and more intense cramping. 3. Narrower cervical canal. In early adolescence, the opening of the cervix, the exit for menstrual blood, is often very narrow. To push blood and tissue through this small opening, the uterus has to work harder and contract more intensely, which causes more pain. 4. Heightened pain sensitivity. Adolescence is a time of high neuroplasticity. Here are several effective ways to manage period pain at home. 1. Heat therapy. A heating pad, a hot water bottle, or even a long, warm bath can significantly dull the ache. 2. Physical exercise. Physical activity releases endorphins, which are the body's natural painkillers. It also helps move blood out of the pelvic area. 3. Dietary adjustments. Magnesium. Found in dark chocolate, bananas, and spinach. Magnesium helps relax muscles. Drinking plenty of water helps prevent bloating, which can make cramps feel tighter and more uncomfortable. Too much salt causes water retention, bloating, and caffeine can sometimes constrict blood vessels, potentially worsening cramps. 4. Over-the-counter relief. Medicines like ibuprofen or naproxen stop the body from making the chemicals that cause the cramping. 5. Rest and relaxation. Stress can make the perception of pain much worse. Ensuring a teenager gets 8 to 9 hours of sleep. When to seek help. While some cramping is normal, you should talk to a doctor if the pain keeps you from going to school or social activities. Over-the-counter pain relievers like ibuprofen don't help. The pain starts several days before the period or lasts long after it ends. The bleeding is heavy enough. Lastly, you're not alone. Up to 70 to 90% of teenage girls have some period pain, and many have quite strong pain in the early years. It usually gets better with time.